Well, listen, thank you, pastors, for being on. We are actually meeting to discuss the unique opportunities of the African American church during COVID-19 and how we are creatively trying to meet the needs of our congregations. This Zoom is going to be taped and potentially shown to close to 1,500 pastors and leaders in the movement of Converge worldwide. And so thank you for taking the time to be here. And I just, for persons who may not know you, we all know each other, but for persons who just may not know you, please give us your name, where you're pastoring, and the context. Are you suburban, urban, a combination of both, and how long you've been doing that? So let's start with Pastor Rod Harrison.
Hey, it's good to be on. Thank you. Our church is Messiah Community Church. It is located probably about 20 minutes northwest of the city of Baltimore. We are largely a suburban church, 90% African American, and with some touches of of contact with our urban communities, people who come to our church from the city. But that's who we are. Largely African American families with young and teenage kids.
Very good. Thank you, sir. Thanks for being on with us today.
My pleasure. Thank you.
Pastor Jenkins.
John Jenkins, First Baptist Church of Glenarden, located in suburbs of Washington, D.C. I'm the senior pastor here for 30. I'm entering and approaching my 31st year as a senior pastor.
And what's the context of your church demographically?
It's a suburban church, African American primarily, majority church.
Very good, very good. I see that we have another pastor that has joined us on our conversation today. They say we say the best for last, better late than never, and he is none other than Pastor James Meeks. Pastor, would you come on and tell us how long you've been pastoring? What context are you pastoring? Are you suburban and urban? And what's the demographic makeup of your church? Is it predominantly African American, or is it a mixture? Pastor James.
I'm Pastor James Meeks, pastor of the Salem Baptist Church of Chicago. I have been the pastor of Salem for 35 years. I've been a senior pastor. This is my 41st year, and the majority of our congregation is African American. I pastor in an urban context, and like the Apostle Paul, who was called to the Gentiles, I was called to the Negroes.
Oh, thank you, Pastor. All right, sir, appreciate you. Pastor Keith Battle, why don't you introduce yourself and give us their context and demographic?
Hey, I'm Keith Battle. I planted a church, Zion Church, in the summer of 2020. So we're coming up on our 20th year. And we have 4 physical locations and an online church where all of them are virtual now, given this pandemic. And all of them are in the suburbs.
Very good. Very good. Of course, Pastor Michael Henderson, I'm pastoring in suburban, urban Charlotte, greater Charlotte area. Been pastoring that church, planted it almost 21 years ago. And we are predominantly African-American context as well. Gentlemen, thank you again for being on today. This Zoom will have the potential to reach 1,500 plus, almost 1,500 churches in Converge worldwide movement alone. And we are talking about something that's not being discussed in the broad evangelical church, and that is how COVID-19 has hit the African American community and how pastors are navigating through this and in light of some of the disparities in terms of what is going on in terms of the healthcare system and et cetera. So we just want to have a little conversation about some of the creative ways you are beginning to minister in your own context towards making sure your people, your sheep, the people in your community are being ministered to. So could we talk a little bit about, before we get into the healthcare system, let's talk a little bit about some of the creative things you've been doing to try to reach people in your context. Pastor James Meeks, would you lead us out here?
Yes, thank you, Michael. We've had an opportunity to partner with our local restaurant, for instance, and since our local restaurant could not have African-American soul food restaurant, I might add, since they could not allow people to come in, we partnered with them. We paid them money to fix food for seniors, and we were able to deliver something like 3,000 or 4,000 meals to seniors. We were able to take meals to the police station. We were able to take meals to the hospitals, and it kept some of our millennials who were going stir crazy because they were inside. We allowed them to go and do some of the packing of the meals and some of the delivery of the meals. So that's one thing we've been able to do. We're also live on television every night, and I would say that anybody could do the same thing in a sense by going live on Facebook every night. And we have brought together congressmen, we brought together doctors, and we're just keeping our congregation totally informed of what's going on in and around our country, in and around our city and state. Also, we've had a privilege of calling every senior in our church. We've called every senior in our church to check on them, to make sure they were doing all right. And then the last thing we did was to set up a website. And the website is for everybody who has a need, they're there to express, and this is in the church, what the need is. And then for anybody who can fulfill the need, they go in and say, hey, I could fulfill that need. So these are interesting times, but I think that God is giving us some tremendous revelation, and God is going to give us every tool that we need to meet this time.
Oh my God, that's amazing, man. I mean, just the context and being the creativity there. The seniors, the seniors are one of the most vulnerable populations, by the way, during COVID-19. And it's really important because a lot of times they don't have the technology to get online and to keep up with what's going on. And so to be able to have people physically contact them, man, that's really good stuff. Pastor John Jenkins, you're going to have a very important phone call coming up, and I wanted to get you in because you've got something that you're dealing with government, and I don't want to go into any more detail, but you're going to have to transition. Talk to us about what First Baptist is doing creatively to try to meet the needs of your community.
Let me, before I respond to that, I just want to give a shout out to Pastor Meeks. He's a very humble person, and he's not really telling the full picture of all that Salem is doing in Chicago. He is one of the most creative pastors, in terms of meeting needs that I've ever met in my life. He's doing something every night live that he's informing and connecting and communicating. I love one of the ideas he did that he had his members go ahead and send money to people that they use regularly, barbers, hair care people, the people who we know are hurting financially. Tremendously creative idea just to have his congregation send resources to these people who we know are hurting and are struggling. So he's just given a snippet of the kinds of things he's doing. I just want to celebrate him. He's a very, very smart guy. So our church has been giving out food, we have adopted 13 schools around our church. We have 2 locations, and around those 2 locations are 13 schools that we've adopted. And we have been notifying the families of those students who we know are on the food program. And some of those children, the one meal that they get that's worthwhile is what they get at school. And so since the schools are closed, we've been giving out groceries every week to families. So I think we're in our 4th week of doing that, and just making those families aware. And so we're giving about 1,000 bags of groceries out every week.
That's amazing.
We also have secured some masks that we've given to the hospital. I'm on a hospital board here in our community, and we provided them with some hospital masks, some masks, and the same thing for the police department. We've given out some masks to the police department because they have to switch out their masks every day. So those are a couple things that we've done that we think has been helpful.
Man, one of the things that I think is critical, Pastor Jenkins, and I think you and Pastor Meeks have both hit on it. You have essential workers, first of all, that have to work literally, and many times they are the most vulnerable, and sometimes they don't even have the basic things that they need, like masks or the kind of equipment or the coverings, things that they would need to be securely safe. And many times we've been reading that the people who are being impacted the most. I'm reminded of a story that went national. An African-American bus driver who got on a bus one day, was driving a bus, and one of the clients got on a bus and was obviously very sick, was sneezing, wasn't covering up, and he went through his route, got off that day, and did a Facebook Live just talking about the terror that he felt, how violated that he felt, and he was just saying that, you know, as an essential frontline worker, he didn't even have a mask, and so what happened eventually, 4 days later, he contracted COVID and eventually died. So, I mean, we cannot take for granted just those kinds of basic needs that these essential frontline workers need in order to maintain their safety. So kudos to Salem and First Baptist. Pastor Rod Harrison, talk to us about Messiah and what Messiah is doing creatively that you would like to share.
Yeah, I don't know that we're doing anything terribly different, but we've connected with a school that we have had a longstanding relationship with, and so similar to what Pastor Jenkins described, we're providing meals for the children and the families who are vulnerable. So we've been working with them. We've also been working with one of the local senior nursing homes. We've had a relationship with them for years, and so we've been providing encouragement to them. You know, we can't go in obviously because of the time, but just keeping them connected, because we find a lot of them are lonely. So we've got a team of people who are just writing to them, letting them know that they're thought of. We have been sending some food to the staff there. We've been doing the same thing with our police and fire departments here, just sending food to them, thinking about them. Just finding out, we just discovered one of the firemen died just a few days ago, and so we'll be just supporting the firehouse through, again, sending letters, sending food, and I'm trying to shake some masks free from Pastor John K. Jenkins, but he won't let me get none of the masks. I told him I'll pay him $10 a piece. So those are just some of the things that we're doing. So nursing homes, schools locally, and trying to feed families as well.
One of the things you, Pastor, that I think, Pastor Rod, I think that's critical. Jesus said it this way: when we do it to the least of these, and I believe even the most vulnerable can be the least of these, we do it unto him. I think sometimes in all of us trying to take care of the masses, sometimes it's just important to take care of seniors, to take care of those first responders, because they're out there in the most vulnerable position. So I really appreciate you all taking that stance. Pastor Keith Battle.
Hey, Mike.
Yes.
Hey, Mike, I don't want to interrupt, but let me say this, and I've been reminding pastors lately too, that in the midst of our reaching out and taking care of police and fire and the essential workers in our community, to let's not forget our own churches, because we are so mission minded and we want to do outreach, but we got people who supported our church for years, who come, who give. and we can't forget them too. Whatever their needs are, we got to figure out what their needs are, and we have to meet the needs of the people in our own church too. So we have a twofold effort. It's in reach and outreach. I just want to say that.
I think that's critical, and we're going to talk a little bit about that, because the people who have been with us that we've been privileged to shepherd are also in need. I think just connecting, and we're going to talk about that in a minute. But thank you, Pastor. Pastor Keith Battle, talk to us about what's happening there at Zion Creative.
Well, it's like what Dr. Meeks just said. I'm kind of glad that's the segue now, because most of our focus has been internal. Because of our campuses. What we tried to focus on, Pastor Henderson, was we have contractors, part-timers, people who set up and break down at our churches, musicians, singers, AV people, people who work with our children who can't get compensated during this time. And it's a number of them. And so what we've identified is we had monies that we were going to use for other purposes this year that are things we're not going to be able to do. So we're trying to find ways now of identifying those who that was a significant source of income for them. And not people who have major full-time jobs that they're still working and they were being police officers at the church as a side hustle and it didn't really matter.
Right.
They don't get that. But some of those people, that AV guy, that police officer, or that set up and breakdown person, or that bass guitar or drummer, that was his livelihood. And so one of the things we're doing now is finding a way to come alongside them financially and support them in a significant way. And so I would say most of the things we're doing now are internal, like our phone tree. We started with seniors. And so all of our seniors have gotten a phone call. Now we're down in the age of 60s. So you and Pastor Jenkins should be getting the call soon. I don't know why y'all talk about seniors like they ain't a part of your life. What we got to do for them seniors? So decade by decade, people are getting calls. They're getting prayed for, and we find out who has significant needs that are more emergency based that we need to send help to.
Yes.
But just the call, hearing is from the senior pastor and first lady, has made a huge difference in people's lives. We're doing a lot of virtual stuff. And so I don't know if we're going to get into that now, but most of the stuff we're doing, just learning how to be a 100% virtual church has been the main thing. So that's where our focus has been.
Man, that's powerful, Pastor Battle, because you and Pastor Meeks both said what we are doing. We have created, we were going through actually a teaching on contagious Christianity by Middleburg and Lee Strobel. This is just talking about sharing our faith. So our life groups were in that. We pivoted off of that and developed something we're calling Entitled Contagious Love. What we're doing is, first of all, our church, we have kept our daycare center open to serve the essential workers, because they've got to have childcare while they're out there. They have to be at work, and so we've decided to do that. We have, as Pastor Meeks said, we've got on our now social media where this is for in reach and outreach. If you've got a need, make sure we're aware of it, and we're allowing people to share their needs. So we plan to meet those needs. And if you want to contribute to that, it's called Contagious Love. You can do that. So it's both in-house and out-house. We've also done the calling post, making sure every at least senior at our church, and then because our role is a little, I was on a call yesterday where pastors are calling 15, 16,000 people. We just can't do that. But we have taken the last 3 years, which was more than I thought, and we are calling all of those members from the last 3 years along with our seniors. And we're trying to work through a personal contact with each one of those newer members who are maybe not be as connected, and we're trying to give them connect points. So I think it's critical that I know many of you are on social media. We're going to talk about that, but it's critical that we stay in contact with our membership. And I totally agree with Pastor James Meeks that we, in our efforts to reach out, we don't forget about reaching in. Let's talk just a couple of minutes about, now that we're here with COVID, we're not able to worship in one facility, or some of us had multiple facilities we were worshiping in live. It has forced the church essentially to become a virtual venue. How have you mitigated that, and how is that working for you? How is that, and what have you discovered in transitioning to a total virtual church experience? Pastor James Meeks, would you talk to us first about that, sir?
Yeah, we were blessed in the fact that we've been on television live for the last 24 years. And so our Sunday service was live on TV.
Wow.
Our Wednesday service was live on TV. We've been doing Facebook Live for about the last 6 years or 5 or however many we've been doing it. So it was no transition to go virtual. We just made sure that everybody was watching TV and that everybody was plugged into Facebook Live. What we did do, and what was just new for us, is that we go live now every night of the week with a show we're calling Faith in Crisis. And that's a touch point for me. The reason I do it is so that every day during this crisis, members of our church can see me, they can hear me, and they can get inspiration from me. So that is a touch point. But I know churches that every night at 7:14, since Second Chronicles 7:14 says, "If my people that are called by my name," every night at 7:14, the whole church does a prayer call. Everybody just dial into the prayer number and they do prayer. I know churches that are doing it every morning. Churches, all the members are calling and they do prayer. So whatever we can do to have an alternative touch point, in addition to our streaming, the worship service, if we can come up with one more day of the week where we get a touch point with our members, I think that's fantastic too.
Thank you, man. That's awesome. Pastor, you're gonna have to give us some of that hookup on being on television every night. My God, sir, you're gonna have to hook the rest of us up, because that is a major investment. But I hear you. You want to touch your people, man. That's really important. Pastor Battle, talk to us about what Zion's doing.
Yeah, so 10 years ago, this July, we started our internet campus. And so we were already reaching a lot of people virtually. So it was a smooth transition. So now we have a staff on our internet campus, and they do small groups on internet campus. They were doing new members class on internet campus. They do communion on internet campus. So now all of our campuses have to do that. Now I told all our pastors, now you all internet campus pastors now. So do everything you're doing, provide the classes online. The one thing we can't do, we have to adjust the way we help people in their grief. Funerals have taken on a whole different light now. We got to do virtual visitations now. We can't really do that. We're doing a lot of Zoom meetings. I'm still doing counseling virtually. I think I'm busier now than before. Like, you would think when COVID put us in the house, we would be, chilling. I'm busier now, man, than before, because all these meetings, you have to have communication. One of the touch points we do is we try to send out a weekly newsletter with a video from me to the congregation. It goes out on an email blast and through text of all the people in our database. I go live about 2 or 3 times a week on Facebook and Instagram, where I'm just out there. Y'all want to talk? What you want to talk about? I might have a little message, or I may not. And sometimes we make it topical about something that will help people manage, like how to, we're going to do one soon with an educator to help people deal with their kids, how to teach them at home. And we got some people to how to manage safely getting food during the COVID virus. So trying to get some subject matter experts on to educate people, but it's just basically being in front of my phone, in front of my laptop all day.
Yeah, you know, I was on a call earlier this week with a bishop who said her life has just gotten out of control right now because of the assumption is now that you can't go anywhere, you're available. Okay, so
Right,
that
right.
people know that you have to stay at home. They know that you can't use the excuse, I got something else to do. No, you don't. You're at home.
Right.
And
Yeah.
so, but I think we're still learning. I'm still learning the new routines and rhythms, man, because we've never had to face anything like this before. So, man, I hear you. Good stuff. Pastor John Jenkins, you did something on Easter Sunday morning that blew me away. Matter of fact, I'm putting it in front of our creative team. But talk about, first, I want you to talk about two things: your Easter service, and now what First Baptist is doing virtually to reach your people.
Now, when you talk about my Easter service, is there something specific about it you want me to talk about?
Yeah. First of all, I thought it was one of the most creative services I've ever seen. Okay.
Yeah.
So could you talk about that?
Yeah. So, I think one of the things, because since I'm at home on Sundays, I'm normally preaching, all day. I've had the opportunity to look at other broadcasts and what other churches are doing and streaming. And one of the things that became apparent to me is most of our churches are doing talking head deal. It's just the pastor talking. And I wanted to do something a little more creative. So I engaged my young adults. Here's the big thing I did. I engaged the young adults in my church to come up with some creative ideas to help make the influence and impact of our online services, which we've been doing for years, our online services. And they put together to do it differently. And matter of fact, I don't even know how I can go back to the way we were doing church. Right. Because it was so impacting. And some of the components of it that made it different is it's not just the choir singing. We do have music, but we've also incorporated a little more regularly something that we've done sporadically in our past, which is testimonies. And as a matter of fact, we have produced the testimony. So it's not just a person talking and giving the testimony. We have produced it. We've added to it video clips and the person talking about it. And so that's a huge, powerful impact, is getting those testimonies. That's one of the things that made it, impacting and powerful. But, online, we're doing all the things that the other guys have said. We're all the stuff that everybody else said we're doing. And the online thing is off the chain for us. And I think that's because people are scared, nervous, they have anxiety, and they want to hear something from the church that gives them hope and gives them promises and gives them a word. And I celebrate the fact that First Baptist Church of Glenarden is got people who are creative, and the Easter service was profound and powerful. So I'm grateful for it. Thank you for your comments about it, Pastor.
Yeah, absolutely. If y'all haven't seen First Baptist's Easter service, please go look at that. You can find it on YouTube. Just go and look for Easter 2020.
Yeah, Inside FBCG is the address, or the whatever they call it, the handle or whatever. Inside FBCG. Okay, and so they have a YouTube channel. I mean, it's worth just looking at and going through it with your creative team, because I thought it was just that impactful. I literally don't like to watch church online, but I watched the whole thing, and it was about an hour. So that's how good it was. So I just think, man, being creative right now is really critical, and I'm trying to figure it out. We're still trying to figure it out. Thank you, Pastor Jenkins. Pastor Rod Harrison, the most creative man on this call, on this Zoom. Talk to us about what Zion is doing.
Well, I'm with Messiah. Keith Battle is Zion. I know we don't all look alike.
I'm giving you his shirt.
So so one of the things that we have found helpful is every day of the week there is a prayer opportunity. So we have a morning prayer call Monday through Friday. My wife and I, we sort of alternate between that, and then we have other leaders throughout the week who are leading prayer opportunities. So we're getting amazing traction with people just calling in for prayer and sharing in the prayer time. We found online to be massive. We started with online a number of years ago, but in a short span of time, we saw numbers that we had never seen before, and the multiples of thousands of people just starting to tune into our services. We mostly do it from from right here at home, and I just have brought in, like Pastor Jenkins mentioned, my son, for example, is a guitarist, and so we just kind of, what we're finding is people who have leadership abilities and potential are now having opportunities to rise up and lead. And so some of our young adults, some people in some of our other areas of ministry who are parts of teams are now starting to lead the way. Some with the phone call, we put together a team, and right away, 50 people just like that jumped on it and said, Pastor, we'll make all of those phone calls. And so every week they're going through through numbers of people that they're reaching out to, and people are appreciating that context. So, again, like I think you may have mentioned it, 2 or 3 times a week we go live. We're trying to do more topical things, right? I think Pastor Battle mentioned some of the anxiety that people are dealing with. Our children's ministry team, they're on twice a week, just dealing with some of the parenting needs and some of the needs that children are having. So we've sort of spread it out over the breadth of our leaders to handle different areas, and that seems to be working out for us.
Wow, thank you, Pastor. Pastor Rod, and really, I've been just saying that I preach at your church. Your team is very creative. First of all, you've got creative children, and they are part of your team, and so that always helps, man. I'm finding that young people they're in that creative space, and the church. One of the things I'm learning is that the church now is going to have to go younger. Our leadership teams are going to have to be younger. I think if we're talking about the church being virtual, that's a younger person's I think space, and those of us who are pastoring, and I think we're going to have to yield to some of that, some of whatever comes with that. But I think the creativity piece is in their wheelhouse, and I just think this is God's transition in the church, and I think it's a good thing that we're going to see a lot of the millennials and under coming to the forefront, particularly during this time. We are forced as a church to be more creative than we ever have. I too, Pastor Rod, we've been experiencing those numbers too on the internet, and I'm just trying to figure out how do we parlay this into something that's very, very consistent, something consistently quality, something consistently good, and it's just really letting the younger people in our congregation take more of a leadership role. So that's something I'm learning through all of this. Listen, I wanted to really shift us a little bit and talk about COVID in the African American community. Many of us are aware that this thing is deadly. I mean, we're talking about the last count, it was almost 29,000 people in the United States, and maybe higher as I speak than that. Some counties are being ravaged by it. But the most consistent thing that I've discovered is that in the African American context in this country, healthcare has always been an issue, and there's always been disparities. And what has happened with COVID is we've seen some of those disparities in our already healthcare system that doesn't seem to be servicing those who are the most vulnerable well. And so COVID-19, by the way, CNN did an article. There are many articles. CNN did an article featuring Magic Johnson, where he says that COVID is very similar to HIV/AIDS. When he contracted the HIV/AIDS virus many, many years ago, he said the face of that was that it was a African American disease, and so there were certain assumptions that were made, a black gay man's disease. And so there was certain attention that was not given. He talks about in this article on CNN that he really began to work to change the perception of HIV and put a different face to it, which helped really bring some real consistent science to it, and really started making inroads. When Magic Johnson got diagnosed with HIV, at that time, I don't know if you remember, people weren't living a long time after diagnosis. People were dying for certain, and particularly people who were poor and could not take all of the cocktail solutions that they had. And so it was difficult. Once Magic got involved, and of course, not just Magic, but the article featured him. Once he got involved and started changing the perception, government dollars were there, and eventually you saw that now people, HIV does not mean a death sentence. Matter of fact, there's many millions of people in this nation that are living with the virus and living almost normal lives. One of the things that's happened though with COVID, in that same article, he likens COVID to HIV, where some of the disparities that have been in the minority community as it relates to healthcare. This is scientific. This is not subjective, very objective information that Black and brown people disproportionately receive worse care than majority culture. And we're seeing in places like Chicago, where Chicago may be 30% Black, but is representing, Pastor Meeks can speak to this, this is a CNN article, almost 70% of the deaths from COVID-19 are of African Americans. And then places like Michigan, Louisiana, the same kind of numbers. It's just unbelievable where people in our communities and in our churches are not just getting diagnosed with it, but are not recovering from it. Pastor Meeks, you many people don't know that you were a senator, was that, for many years. So you understand government and legislation. Would you speak to some of this and how Salem is trying to mitigate through some of this?
Yeah, when I interviewed our two Congress people on Monday night, I brought up this centuries ago. And because here in Chicago, 72% of the deaths are African American, and we're 30% of the population. And so they said that the governor decided where the testing facilities go. And I explained to them that as members of the Black Caucus members are going to have to start petitioning governors to say that if we are dying disproportionately, then we're being tested disproportionately too. We're being tested at a lower rate, but we're dying at a higher rate. So now we're starting to shift. We saw a testing center open up in our community just yesterday. So that's one thing. We got to put more pressure on our elected officials to make sure testing is in the African American community. But this is such structural racism. It depends on your color when you go into the hospital, whether they choose to treat you, how they choose to treat you, if they choose to treat you. It was said that if you go into the hospital with COVID and they find out you don't have insurance, they'll send you home. You subject to not get the right medicine that they're giving everybody else. So the structural racism that has existed in America from slavery until now is the same thing. I do hope that we not by the line, hook, line, and sinker, that African Americans, we got the high blood pressure and we got diabetes and we got all asthma and all the underlying conditions that's killing us. That's not all necessarily so. We also have poor access to healthcare and and insurance. we have poor access to that. And that's playing a big part on who's dying and who's living.
Pastor, I do want to stay here because I think that you hit on something that's that needs to be really discussed. First of all, the President's Council for COVID-19, Dr. Fauci came out and said Black people have all these pre-existing conditions that predispose Black people to COVID and dire results. And I just found that to be the easy way out, in that there are other communities that have pre-existing conditions as well that aren't dying at the alarming rates of African Americans. And so, Pastor Meeks, real quick, because I want to get to some of the other panelists, but real quick, is it a pre-existing condition issue, or is it access to health care, or is it a combination of both in your mind?
I think it's access to health care. I think that, as a matter of fact, Dr. Brian Williams, and I hope that sometime, Mike, you and John will have him on your Zoom to talk to your congregation. He is the guy who was the surgeon when the lead surgeon on that night. He gives an entire chronology about the healthcare disparities. And when a Black patient comes in the hospital, they may not even give them the same pain medication that they give a white person making six figures. And so the value of life, the value of you in a plane crash and Michael Jordan, you're in a plane crash and Jimmy Kimmel in a plane crash and the paramedics show up and somebody has to get worked on first. Who gets worked on first? And so a lot of that is happening with African Americans and COVID.
Thank you, Pastor Meeks. Some of your conversation was going in and out, but I was able to hear you say that you felt like the most, as a former state senator, by the way, and you would have had access to all of these kinds of things going on for years. So in your position, you would be, I think, more likely to understand the overarching issue. And you're saying, sir, that you feel that it's an access to healthcare above all else. Is that correct?
Absolutely. It's access to healthcare above all else. And
okay,
what kind of treatment you're going to get in the hospital.
Fantastic. Pastor Keith Battle, come on, let's talk to us, because you don't have a lot of seniors in your congregation, but talk about this, because this is a conversation that is not being had in the church. Okay, this conversation is not being had in the church, and I think it's important and imperative that we begin to have this conversation, because this is revealing something that is already there. It's just magnifying it now because of the severity of it. So when we talk about the disparities of healthcare, this is a real issue in our nation. And I think if anyone's going to speak up about it, the church has to be the first place to speak up about it. And not just Black churches, all churches, because we really need to begin to tackle this issue if we're going to see our people feel safe and be safe in a nation that has billions of dollars and capabilities that are not being realized. Talk to us, Pastor Battle, about this.
Yeah, well, first of all, thank you for this platform and this conversation, Dr. Henderson. It's imperative, and I want to thank Senator Pastor Meeks for his not only service to the kingdom, but also service from a policy-making standpoint to our people. Thank you for pioneering and being an advocate for justice. My daughter lived in Harlem for a period of time, and when I would go to visit her on Lenox Avenue, 125th, 136, somewhere in there, when you walk out of her apartment building, Mike, there's a liquor store, there's a laundromat, there's a McDonald's, Across the street, there's a Dunkin' Donuts, there's a Chinese food restaurant. And I asked her, where do you get your groceries from? And there was nowhere within walking or any reasonable driving distance where there were healthy groceries. And I think part of the impact on our culture, not only not access to quality healthcare, we don't have access to quality food, and which is perpetuating the diabetes and the hypertension and some of the underlying issues that are really legitimate in our culture. So we have soul food spots and carryouts everywhere, but no place where you can get some broccoli and some cabbage and some oranges and apples and prepare a meal that would actually help your immune system, right?
Right.
And what I would say historically, what I appreciate the James Meeks and the others of our historical leaders whose shoulders we stand on, when we couldn't get education, quality education, we started our own daggone schools. So we have HBCUs today because we couldn't get into the best schools. We created schools. And I'm saying we got to create healthy, nutritional environments too to take care of ourselves, because by the time policies are made forth that are equitable, that make it fair for us to get quality health care as well as quality groceries in our community, we better start some of this stuff ourselves. And I would say trying to train our people to put better gas into their tanks, right? Because I am trained to eat fried chicken and donuts. I'm trained for it. I'm trained to, you know, when you're a preacher, you get 2 biscuits, you get 2 pieces of chicken, you get the macaroni and cheese, you get that punch. The stuff that's in our fellowship hall is killing us too, because that's what we're used to consuming. And I think it starts with us paying attention to that issue too, because I think that's strategically killing us too, that there's no access to us to having healthy food around us as well. And I just wanted to speak to that.
I totally, Pastor Battle, I totally am tracking and affirming what you said, because I think in poor, underserved communities, we used to call them red line communities, where you would not get the kind of quality foods, anything really. There was nothing there except things that were not healthy for us. And so when we talk about pre-existing conditions, I totally agree. We do have those, but we have those because oftentimes in the poorest communities in our nation, Black and brown communities oftentimes have the least amount of access to quality foods, to quality health care, to quality services that will prepare us to be able to deal with things as they come. And so I think it's a cop-out just to say there's a lot of pre-existing conditions without dealing with why these conditions are pre-existing. That's where we need to deal. But I also think there's a personal responsibility in this. We didn't learn nutrition the right way many times coming up in some of the poor communities, but I think it is incumbent upon us now that we know better to begin to demand in our communities that certain things are there if we have to create those things ourselves. So I totally agree with that argument that when we didn't have before, we had to create, and we may have to create on this level, but to blame the people who are victims of the system, if you will, for their poor health, what to me is criminal when we're not looking at the full picture.
That's right.
Pastor Rod Harrison, jump in here, man, and tell us what you think.
Yeah, I think both, obviously, again, thank you, Pastor Meeks and Pastor Battle. They hit on 2 issues, but Pastor Meeks, you hit on the issue of structural racism or systemic racism. And I think it does go back to that in essence, because so many of the people in the Black community, our community, who are being affected are those who are frontline service people. The person that you mentioned, Mike, at the early part of this call was a gentleman who was a bus driver, right? That is an essential service in any city. And so many, and here in Baltimore County, the seat of the most cases of COVID is in areas that are predominantly African American, right? And so we were starting to ask, so why is this? And it's because so many of our people they can't work from home, right? They got to work to make ends meet. And so, right, the systemic nature of racism is that it cuts Black people out of opportunities. I was talking with a host of white pastors a couple of days ago, and they're talking about all the things that they're doing, and the systems that they have engaged in. I said a lot of our Black churches are not positioned to do that, so we have to come alongside them. We have churches who are making Messiah their church online during this time because they don't have a place, right? They don't have the systems and the equipment to do the online ministry, right? That's a lack of resources, and a lack of resources points back to a lack of economic opportunities, and so we have to see every crisis through a very different lens as African American people, because as Pastor Meeks pointed to, right, the systemic nature of racism plays itself out, and it is accentuated during crises like this, and we continue to pay a very high price.
Thank you, Pastor Rod. One of the things that I think, and these are red words, these are lightning rod words. I think they need to be said. But one of the things I want to break down for us is this whole phrase, systemic racism, because I think that sometimes people take that personal and become defensive when they hear words like that. God-fearing people become very defensive in hearing words like that, because in some people's mind, we don't live we're living in a post-racial or racism a society, which is simply not true, but people feel that. But our broader audience, will be listening and watching this. I want to break that down. When we talk about systemic racism, this is not an individualized thing. It's systems that are set up so that some will win and some will lose just based on how it's set up. So when Pastor Meeks, Pastor Keith Battle mentioned that when you go into poor minority communities, they don't have in those communities quality grocery stores, they have liquor stores, it's been set up that way. And so when we talk about access to healthcare, many of the testing determinations for COVID-19 were not made by people of color. It was made by governors who sometimes are out of touch. And so even testing is critical in this environment. I don't know in the minority communities where a lot of testing centers are. Matter of fact, in the greater Charlotte area, there was a protest recently to our local officials about making these tests available in the communities that poor people live. And they was just not even thought about. So when we talk about systematic, it's not that somebody's saying, wearing a white sheet and calling somebody the N-word. That's not what we're referring to here. We're referring to systems that are set up to keep some people in charge and some people subservient. And these systems were set up many, many, many years ago by people who felt like that. But people who don't feel like that today are still benefiting from those systems. And unless we are able to recognize those systems, we will still perpetuate the systemic racism that those systems brought many, many years ago. Pastor Meeks, would you speak to that?
Yeah, and most of our white brothers and sisters are some fantastic people who don't even realize that government doesn't sit down and say, okay, we need to put 20 testing centers in our city, and we're going to put 5 here, 5 there, 5 there. They don't even realize that government is deciding based on race where to put things, just like school systems. They don't even realize that there are some school systems where teachers have doctorates and masters, and the kids have computers and top-notch books. There are other systems where the teachers don't have the same quality education and the kids don't have computers and don't have the access to the internet, but they all take the same ACT test to decide who's going to get into what college. And so that's all a part of the system that many people, many white Americans, they benefited from a system that they don't even realize they are benefiting from. They woke up on third base and they think they hit a triple. And they don't realize that they woke up on third base. They didn't hit that triple. And but when it is explained to them, it's just like many of the colleagues in our cohort. When it is explained to them the advantages that they've had that we did not have, they're able to intellectually see it and say, oh, I get your point. And so we're not arguing from the hooded sheep argument. We're not arguing from the who's calling who the N-word or names. We're not arguing. We're arguing from the fact that a system here in America benefits some, disadvantages the other. And so those of us who are disadvantaged, we're just disadvantaged in every area: healthcare, education, housing, stimulus package, being able to apply for and be a part of the banking system to reap those ones. It just goes across the board. And so when people get sick, naturally, when white America catches a cold, we catch the flu because we're already behind the 8 ball.
Very, very good. Pastors, thank you all, because I think this has been very enlightening today. Our time is almost up, but this is what I want to do. We're talking to a lot of pastors all across the nation. Many are varying size churches, very ethnicities. What advice would you give in closing remarks here to pastors trying to mitigate this COVID-19? What needs to happen for pastors and churches really to come out of this, maybe even better on the other side of this? What are one or two words of advice that you would give going forward, even as it relates to this whole thing of the disparities in healthcare? What would you?
Let me say this real quick, Mike. I would want people to say, and I say to all of the pastors, when this is over, and it will end, it will be over, what do you want people to say about your church once this is over? Do we want people to say our church sat on the sidelines, waited till it was over? Do we want people to say, man, every day during that crisis, this church, the Mount Hope Church, what they were out there doing A, B, and C? So what do we want people to say about us after it's over? It depends on what we want people to say about us after it's over, how we'll act now.
Amen. Thank you, Pastor Meeks. In closing remarks, Pastor Rod Harrison, what do you want? What advice?
Yeah, I would agree. I think carpe diem, right? This is our moment, right? Crisis is a moment for the house of God. And like nobody else, we have the hope to offer. And I think we have to offer that hope consistently. We have to come alongside people, come along our community, come alongside our community officials. The door is open for us, right? In a moment of crisis and fear, the door flings wide open for us. And we have to walk through that door with courage. We have to walk through that door with clarity. And we have to walk through that door, I would say, having some dexterity, right? Being able to move and flow as things change.
Pastor Keith Battle, would you give us the final word, sir, on what your advice you would give?
Yeah, what COVID-19 has done for many of us who made the adjustment to go virtual is grown our churches. Many have gone from hundreds of people coming to their physical location to thousands watching online. Churches have grown double, triple, grown by 10 times its size. And I'm saying, before you get so excited about going back to your physical location, don't leave those thousands of people who connected with you online. Stay with them. Even if you go back, learn to be ambidextrous. Learn to be in person and virtual at the same time, because those people connected with you during COVID-19 for a reason. Continue to shepherd them, find ways of connecting them, bringing them into your ministry in some way, virtually, through giving, through mentoring, through discipleship. But don't leave this opportunity and go back to normal and leave what was a tremendous opportunity and access to people.
Amen. Thank you, sir. Well said. I want to say in closing, listen, this is a time for the body of Christ to transcend all barriers and come together to advance the kingdom. I mean, COVID has taken the competition out of church. Just let's be honest, that's been a real issue. You know, how big is your church? We're all on the same playing field right now. That's what COVID has done. It has also brought us to a place that the church has an opportunity collectively to have impact that we've never had, and that's been said. And I just want to say that this is an opportunity for us to minister to people who would never come don our doors. We can minister to people now who would never get to our physical location. Let's not sleep that. Let's use this to make our ministries broader, but also let's partner up with each other. There may be something you're doing better than me. Teach me how to do that. There may be something I'm doing better than you. Then let me teach you how to do that. This is not a time for the church to be in competition. This is our finest hour, our finest opportunity. And the last thing the world needs to see is us fighting about the thousands and millions of people who we have access to now that we didn't have access to before. I think it's a great opportunity for the church to finally operate as one. And I would love to see us begin to reach outside of our comfort zones to learn from each other and cross-pollinate with each other and to really help each other bring in this final harvesting. I believe that God has given us an opportunity to do just that. So, man, I'm looking forward to this. I think we've got great opportunity. And I want to say to all of the pastors that are on, thank you for taking the time. Your time is so precious. Thank you for taking your time to share this time. This is going to go to our movement, Converge Worldwide, but we don't know where this is going to end up. But this is a real, honest, frank conversation that I think the church needs to have. And thank you for being willing to have that conversation.
Thanks, Mike.
Thank you, Mike. Thank you for having us.
Yeah, thank you, man. Honored.
Thanks so much for coming on. Talk to you soon.
Appreciate it.
All righty.